$50 a month. That is what some people on Medicare are now paying for a weight loss medication that used to cost them close to $1,000. The change took effect on July 1st, 3 weeks ago, and most people who qualify still have no idea it exists. Here's exactly how it works, and exactly who gets it. First, a correction that will save you a phone call. If you came here searching for Ozempic, Ozempic is not part of this program. Neither is Mounjaro. Those are diabetes drugs, and Medicare has always been allowed to cover them when they are prescribed for diabetes. Nothing about that changed. What changed is something Medicare was legally forbidden from doing for 20 years. Under federal law, Medicare Part D plans could not cover a medication prescribed purely for weight loss. Not sometimes. Not with an exception. It was written into the statute when Part D launched in 2006, and it stayed there. The Centers for Medicare and Medicaid Services, the agency that runs Medicare, has now built a way around it. It is called the Medicare GLP-1 Bridge, and the word bridge is doing real work in that name. Let me explain what a GLP-1 actually is, in plain English. GLP-1 stands for glucagon-like peptide 1. These are medications that mimic a hormone your body already produces, one that tells your brain you are full and slows how quickly your stomach empties. They were originally developed for type 2 diabetes. Researchers noticed patients were losing significant weight, and separate versions were approved specifically for weight reduction. Those weight loss versions are the ones Medicare could never touch. Now 3 of them are available for $50 a month. The covered medications are Wegovy, in both the injection and the newer tablet form, Zepbound, but only the KwikPen formulation, and Foundayo, an oral option that CMS added to the program in April 2026 after it received FDA approval. That is the complete list. 3 drugs. So who qualifies? CMS built the eligibility around 3 tiers, and they are based on body mass index, which is a number calculated from your height and weight. Your doctor has it in your chart. The first tier is the simplest. A BMI of 35 or higher qualifies on its own. No additional condition required. The second tier is a BMI of 30 or higher, combined with at least one of the following diagnoses: heart failure, uncontrolled high blood pressure, or chronic kidney disease. The third tier is a BMI of 27 or higher, combined with a documented history of at least one of these: prediabetes, a previous heart attack, a previous stroke, or symptomatic peripheral artery disease, which is poor circulation in the limbs. You also have to be enrolled in a Medicare Part D prescription drug plan or in a Medicare Advantage plan that includes drug coverage. Do you see yourself anywhere in those 3 tiers? If you do, here is the part that trips almost everyone up. You cannot sign up for this. There is no enrollment form, no website where you create an account, no phone number where you register. If someone calls you offering to enroll you in the Medicare GLP-1 Bridge, that is not how this works, and you should hang up. Your doctor does it. The process runs like this. Your provider writes the prescription and sends it to your pharmacy. That triggers a prior authorization request, which is simply a form confirming you meet the medical criteria. Your provider completes it and submits it directly to Humana, the company CMS contracted to process these approvals. Notably, it does not go to your Part D plan at all. Once it is approved, you pick up the prescription and pay $50 at the counter. CMS has said the process can take up to 72 hours. And there is one detail inside that paperwork that matters enormously if you are already taking one of these medications. Your provider attests to whether you met the criteria at the time therapy first began, not today. CMS gives a specific example in its guidance to providers. If someone started GLP-1 therapy in September 2024 with a BMI of 37, and their BMI is 34 by the time of the July 2026 request, the provider should attest that they met the BMI 35 criterion when therapy started. Read that again if you are already on Wegovy or Zepbound. It means losing weight does not disqualify you from the program that helped you lose it. Now for the part almost nobody is talking about, and the reason you should not stop this video here. The $50 does not do everything you might assume it does. The bridge operates entirely outside your Part D benefit. That is not a technicality. It has real financial consequences, and CMS states them plainly. Your $50 copay does not count toward your Part D deductible. It does not count toward your annual out-of-pocket cap, which is $2,100 in 2026 and rises to $2,400 in 2027. Every dollar you spend here is money that does not move you closer to that ceiling. If you take other expensive prescriptions, that distinction could cost you real money over a year. There is more. If you receive extra help, the low-income subsidy that reduces drug costs for people with limited income and resources, those subsidies do not apply here. Your copay is still $50. Manufacturer coupons cannot be applied. Discount programs like GoodRx cannot be applied. The Medicare prescription payment plan, which lets you spread drug costs across the calendar year, cannot be used for this either. $50 a month is $600 a year. For some households, that is manageable. For others, it is not. And it is worth saying out loud that a quarter of Medicare beneficiaries had an income below $24,600 in 2024, according to KFF. This program is a real improvement. It is not free. There is one more group that needs to hear this clearly. If you already get a GLP-1 through your regular Part D plan, because you have type 2 diabetes or moderate to severe sleep apnea, or established cardiovascular disease, you do not need the bridge. Your coverage continues as it is. In fact, you are not eligible for the bridge, because it exists only for the weight management use that Medicare was previously prohibited from covering. Do not let anyone move you off working coverage onto this program. So how many people does this actually reach? KFF analyzed Part D enrollment data from 2023 and estimated that roughly 3.8 million beneficiaries met all of the bridge criteria. That is a large number of people. It is also far smaller than the number who might assume they qualify, because the clinical conditions in Tiers 2 and 3 narrow the field considerably. Which brings us to the calendar, and this is the piece I want you to write down. The Medicare GLP-1 bridge runs from July 1, 2026 through December 31, 2027. It is a demonstration, which in plain English means CMS is testing an approach and collecting data before deciding what comes next. After that, CMS has signaled that longer-term coverage would move through a separate model inside Part D. That transition has not been finalized, and how it works will depend on decisions that have not been made public yet. Watch for it during open enrollment, which begins October 15. I am not going to tell you this program is right for you. That is a conversation between you and your doctor, and these medications have real side effects and real considerations, particularly around muscle loss in older adults. But here is what you can do this week. Look up your BMI or ask your doctor's office for it. Compare it against the 3 tiers I described. If you land in any of them, call your provider and ask one specific question. Can you submit a GLP-1 bridge prior authorization for me? Use those words. Prior authorization. GLP-1 bridge. Many providers are still learning this program exists, and being specific saves weeks. If you are already taking one of these drugs and paying full price, ask your provider about the retrospective attestation, so your earlier BMI can be documented. And if a call comes in offering to sign you up, remember there is nothing to sign up for. Only your doctor can start this. This is general information, not financial, tax, or medical advice. Rules change and individual situations differ, so confirm your own situation with Medicare directly at 1-800-MEDICARE or with your doctor. $50 a month. It is not a discount, and it is not automatic, and nobody is going to call and offer it to you. It is a form your doctor has to fill out, and it has been sitting there available since the 1st of July. Make the call.